Hello, my name is Joseph Forrest, and this is my persuasive presentation of Dying with Dignity, a presentation of DNR status and advance directive with a living will. Most people often don't think of what a DNR status is, and as my peers stated, some didn't know what a DNR status. A DNR status is a do not resuscitate order. Do not resuscitate order is a order to which a patient no longer wishes to have any advanced life support put in place so that he's able to continue living. This would pertain to chest compressions, intubation, and any other potential enteric food feedings via an IV or a nasogastric or orogastric tube. I want my audience to imagine that they awaken with every bone in their rib cage fractured, or to have a tube stuffed down their throat for them to breathe. All this while you're gagging on this tube. I want you also to imagine that you have another tube stuck down your nose or stuck down your throat to suction the contents of your stomach so that you're able to not aspirate or choke on your own stomach contents. All this while you have a piercing pain through your urethra from my Foley catheter so that we're able to monitor the urine output so that we're able to see how well your kidneys are perfusing. And then to hear someone scream clear while you're violently electrocuted by 200 joules of electricity so that we're able to defibrillate your heart and continue or restart your heart. Most patients are unconscious while they're having chest compressions, but they do awaken with multiple rib fractures and feel this pain. Some patients don't want to feel this pain, and I know that I am personally one of these individuals that if I'm in a terminal state, I do not wish to have CPR done on me. CPR, according to ACLS, is supposed to be 100 compressions per minute. This is a very fast, very violent pace, and with this pace, it causes fracture, as one of the authors states, it causes fractures of every single bone in the rib cage and the sternum. The life expectancy of patients after having CPR is about 5% after CPR is done, and about 1.5% 5 years long term. So patients that have CPR done and the life expectancy afterward, just the statistics don't add up. So my presentation is to try and convince the audience to have DNR set in place prior to it coming down to the wire and deciding at last minute if they wish to continue or not continue any life-saving efforts, and to not have witnessed or anyone that has witnessed anyone getting chest compressions on their loved one knows that it's a very violent experience, and one that I would not like to see on any of my loved ones if they're terminally ill already. It's completely different, and it goes into another ethical dilemma on if you're a very healthy individual and you wish to have CPR done. It's completely understandable. You want to live, but if, as most of my peers or the population states, that if you have a terminally ill disease, cancer, metastasizing, and you have a very short life expectancy, and that you are to go apneic or pulseless, that they do not wish to have CPR continued or have CPR performed or intubation. It's a very violent procedure, and the life expectancy afterward is not that great. There are local hospice houses that are put in place so that we're able to take care of patients that have DNRs put in place. The local hospice houses often run out of funding and sometimes have to close their doors. I'm asking my audience to donate to a local hospice house in their area. A local hospice house in our area is Good Shepherd Hospice. Good Shepherd Hospice is located in Missouri, Kansas, Arkansas, and Florida. And I have the website. It's www.goodshepherdhospice.com, and you're able to make a PayPal donation. It can be anything from a cent to as much as you want. All the donations are able to be written off in your taxes at the end of the year. And if you have a loved one that is nearing the end of life and you would like to donate, it would be greatly appreciated. Like I said, most of these houses are underfunded and sometimes don't make it. This is Joseph Forrest, and this concludes my persuasive speech presentation. Thank you very much.